If your baby was born prematurely before 37 weeks or had a birth weight of less than 2.5 kilograms, you will be given this leaflet created by the Lullaby Trust at your discharge from the hospital. This advice also applies to twins and triplets who will often be born before 37 weeks. Babies who are born prematurely or with a low birth weight are at increased risk of sudden infant death syndrome. It is important that safer sleep advice for these babies is followed for 1 year from their due date, not from the day that they were born. Babies should sleep on a firm, flat mattress in a cot or Moses basket. Babies should not be placed on their sides or on their fronts asleep. They should only sleep on their backs with their feet touching the base of the cot. There should be no pillows, quilts, duvets, cot bumpers or any other accessories such as pods or nests or toys, comforters or sleep positioners in the cot. If your baby has spent time on the neonatal unit or had close monitoring on the postnatal ward, they will have been under constant supervision. Therefore, the way that a baby sleeps in hospital will be different to the way that they should sleep at home. For example, they may have been sleeping on their front with rolled blankets or towels to keep them in one position, and it may take some adjustment for them to get used to sleeping on their backs. Babies are safest when their parents are close by. They should always be in the same room as you, day and night, for at least 6 months past their due date. Babies' heads should remain uncovered whilst indoors. This is because they regulate their temperatures through their heads, and they are at risk of overheating. This means no hats indoors. Babies should be covered with 1 layer of blanket, no higher than nipple level. Be cautious about folding blankets, as every time you fold a blanket, it becomes another layer. Most sleep bags are suitable for a baby whose weight is 4 kilograms or 8.8 pounds. The tog of the sleeping bag should be appropriate for the room temperature, and the size and fit of the sleeping bag should be correct to prevent the baby slipping inside. Please ensure you read the manufacturer's guidance. Room temperature should be kept at 16 to 20 degrees. A nursery thermometer will help to make sure that every room where your baby sleeps is at a safe temperature. You can check your baby's temperature to make sure they are not too hot or too cold by feeling the back of their neck or chest. Don't use your baby's hands or feet to check their temperature, as they will always be cooler than the rest of the body. A normal temperature for babies is above 36.4. A fever is considered to be 38 degrees or above. Bed sharing and co-sleeping is not recommended at all for babies born prematurely or with a low birth weight. This guidance applies for a year from your baby's due date. Babies born prematurely or with a low birth rate have a significantly higher chance of sudden infant death syndrome if they share a bed, chair or sofa with a sleeping adult.